And they taught me a lot about the whole non-operative part about pain, which I had never understood before at all. So I had gone through residency, medical school, fellowship, had no clue about chronic pain. And they taught me some, but they actually didn't understand chronic pain very well back then either, because the neuroscience hadn't really caught up with this whole thing. So I was doing lots of surgery. I was very aggressive for about, 10 years or so. And I felt really guilty if I didn't find a reason to do surgery. Then my results weren't very good. Then the data came out that the success rate for a spine fusion for back pain was about 25%. So I just stopped. I'm going, well, whatever we do, this is not going to happen because it's a big operation. As you know, you're an anesthesiologist, you get to see the spine fusions. It's a big deal. And I honestly thought we're in the 90% success rate range. Then it also became apparent that the research shows that disc degeneration is not a disease. It's just a normally aging disc. And you know this really well. It's been well documented that there's no correlation between back pain and disc degeneration. Yet I have patients come in all the time saying I have bone spurs, bulging disc, ruptured disc, herniated disc, etc. None of those have been shown to correlate with back pain. So about 1993, I just simply quit doing spine surgery for back pain. Meanwhile, the world was going crazy. So between 1997 and 2005, spine surgery for back pain went up about 600%. And it keeps climbing. The spine industry keeps looking at this as a growth industry. So right now, it's between 300,000 and 400,000 surgeries, fusions being done a year. They think by 2020, which isn't that far away, it'll be up over 1 million a year. And there's not one research paper that shows that it works. What's happened is that the non-operative care has become so effective that I now have over 100 surgical patients that have very severe bone spurs. They're pinching the nerves, they're causing sciatica, and I have them on the schedule. But the data says to do rehabilitation first. We call it prehab. And by setting them up with this process over about 8 to 12, in fact, we do this on every patient for 8 to 12 weeks, no matter what, unless it's emergency, people started canceling the surgery.